case number 13. And again, so you go systematic. So this is, get it right. So that's a 4-chamber. Okay. What are you seeing here? Does it look as normal or abnormal? So you're seeing the atrium look normal, and the ventricle also look normal. What about the septum? You see there's a defect here. You see the below the level of the AV valves, you see there is almost there's a defect there in the septum. Okay, when you see that, and I go up and I go for the 4-chamber, for the going up for the 3-vessel looks normal. The main problem really here, where you see it in a 4-chamber view, and you see this defect or the hole essentially, and that's below the level of the AV valves, so like a perimembranous VSD. Of course, it's not enough for this to make a final diagnosis. You will go and look at the color Doppler to demonstrate the flow across this VSD, and also go for the septal view because you want to make sure that it's not a false positive diagnosis of a VSD. Okay, your responses, more than 90% of you knew that it was abnormal, and that's not an easy diagnosis, but you got it right. So fantastic, you're really definitely an expert here. And then again, more than half of you got that diagnosis right, which is the fact that it's a VSD of ventricular septal defect, even without actually putting the color Doppler. Yeah, so that's very good. Excellent.
Well, we know that VSD are very common, and obviously, according to their size and to their location, they can become clinically important and with some consequences. But well, I remember Lindsay Allen saying, well, VSD, let's ignore them. I think that it's especially if they are very small, when they are in association with other anomalies, that they are a kind of a trigger that lead you to look better at the heart. But I think that in themselves, they are not one of the major problems.
Yeah, so I agree with you. In terms of the location, so obviously perimembranous VSD is associated with chromosome abnormalities, while a small muscular VSD, the association is very weak. And also the association with cardiac abnormalities. How do you define small VSD? Is that when the defect is less than 3 millimeters. And if you have something like that, don't frighten the patient. I think you just need to follow up, because sometimes they close later in pregnancy or in the first year of life. Okay, so let's move on.
So, do you always do invasive diagnosis in case of VSD or not?
Not the muscular ones, and if it's like isolated. So the key really is isolated, and therefore that's really important to do detailed scan. But the small muscular VSD, in this case, no, we would not routinely offer amniocentesis or invasive testing, because the risk of or association with chromosome abnormalities is very low. But very membranous VSD, yes, we would, because there is obviously association with chromosome abnormalities, in particular if there are associated cardiac anomalies, for example. Yeah. Okay, so let's move on